Here at the Wadsworth Center. And I wanted to just take a few moments today to talk about where we are with respect to COVID, our response, and also what we're starting to see emerge in other parts of the world, particularly in China, Hong Kong, as well as in the United Kingdom. So I've said all along we were going to keep track of the numbers. We're monitoring the numbers very intensely. And also I've said I'll be very open with the public as we start to see any shifts or any trends that I want to make sure they're aware of. And so we're here to give you an update on this. And also this, this BA2 subvariant. And I just want everyone to know that we've never taken our foot off the gas when it comes to our preparedness for dealing with this pandemic. We never had a high five moment and said it's over. A couple of observations of what we're seeing here, but also just to talk about where we are today. This Wadsworth Center is truly the location where the people who work here are the unsung heroes of the pandemic. We toured last summer. I was here again in the fall, and it was Wadsworth that allowed us to identify and test COVID patients here in the state of New York long before testing was readily available. And so they've really done a tremendous amount of work here. But also this building, this facility, in my opinion, here in the state of New York, should be a world-class facility. You know, the work they do is critically important. The rest of the nation looks to what we do here in the state of New York, and that is why I wanted to come to this place and to mention that this is part of our initiative to really build back our healthcare system, which had been knocked down so hard before the pandemic. And so my budget actually proposes $750 million to rebuild this center, as well as $1.6 billion for upgrades in healthcare overall as part of our $10 billion plan. So we know where we have to help. We have to help financially distressed hospitals. We have to make sure we do more to recruit more healthcare workers. This was a crisis in the making even before the pandemic, but we've seen how vulnerable our populations are, even in nursing homes, hospitals, and home care aides, when it comes to protect people independent of a pandemic, but certainly when there's a pandemic underway, and we have to make sure that we're continuing to invest in that. And that's why I'm committed to continue to grow our healthcare workforce by 20%, as well as support them with higher wages and bonuses as well. So, like I said, I want to make sure you know what we know when we find out about what's happening here. This subvariant is going to be, something we're watching closely. We're not being alarmist about it. We're just transmitting the information as we get it. But the number one the basic way to deal with this right now is if anyone feels symptoms at all, just get tested immediately. That's how we can stop it from spreading. You know what the symptoms are, and Dr. Bassett can talk about them as well as Dr. St. George. But if you feel them at all, this is when you're smart, and that is why we've been so aggressive about getting testing kits out there. They're readily available. There's no excuses. Every household should have them, so you can protect yourselves, your children, your older parents, and people that you know are vulnerable, people who are immunocompromised. And so we want to make sure that we're continuing to provide this information to people, as well as making sure that we get information about treatments. Now, this is important. We have not focused as a nation as much on the treatment capabilities. You should, as first sign of symptoms, let your doctor know so you can start getting the treatments that can stop the circumstances from getting worse. And right now we're not seeing any spikes in hospitalizations or cases. I'll get into the numbers in a couple minutes, but I'll first let Dr. Bassett give us an update, and then Dr. St. George will give us an update as well. I want you to hear from the experts. They'll be available for questions afterward, but I just want New Yorkers to know, again, in real time of what we've learned about what's happening with Omicron BA2. Dr. Bassett?
Thank you, Governor, and thank you for your words about this Wadsworth Center. These labs are the second largest public health labs outside of the Centers for Disease Control, and they are a true jewel in the crown of public health in New York. I want to begin by saying that it's no surprise to us that we are seeing COVID cases tick up. We are seeing this as society opens up more and as this virus continues to adapt to human beings and to our vaccines. Yesterday's data showed that New York City, which has been the COVID gateway for our state, has gone up relative to the past 7 days. The 7-day average a week ago was 8 per 100,000. It's now to 11. These are very low numbers. These numbers are small, but we have seen some small relative upticks across the state. And as the governor has indicated, we're monitoring this closely, and we're monitoring the variants, which Dr. St. George will discuss in a little more detail in a moment. And we're also, of course, watching carefully what's happening in other parts of the world, and especially in the United Kingdom. At this point, even with the rise in cases in the BA2, which is a sublineage of the Omicron variant, we don't expect to see a steep surge in cases in New York State. At the moment, BA2 comprises about 42% of all the cases here in the state. It has been rising over the past couple of months, but we have not seen the kind of rate of growth in this dominance that we've seen in the UK and in Europe. BA2 is more transmissible, as you know, than the original variant, but it does not appear to cause more severe illness, and it doesn't appear to have any more ability to evade the vaccination immunity. So if you're concerned about what you should do given the news that you're hearing, I want to just emphasize, as we have been throughout my time as commissioner, and the governor has throughout her time as the governor, that if you're eligible for a booster, now is the time to get boosted. As of March 20th, among people who are 18 and older, we had about 45% of people who in New York State who were eligible for the booster and remained unboosted. And if your child has not gotten vaccinated or boosted, now is the time that you should really do that. We have about 35% of children between the ages of 5 and 11 who are fully vaccinated, and we need that number to go up. Although 42% have received at least one dose. The governor has already emphasized that we need to use more our capacity for treatment. We are not worried in the state at this time about access to treatment, and so if you have COVID symptoms, you should not ignore them. And they're basically flu-like symptoms, fever, cough, even diarrhea. Go get tested. Don't wonder about it. We want people to be able to take advantage of the treatment window, which is 5 days from the onset of symptoms. So if you wait and feel groggy for 3 days, then go get a test, then call your doctor, the treatment window would already be closing. But we want everyone to take advantage of treatment. This is for people who have mild to moderate disease and will reduce the risk of hospitalization. And of course, I want to remind everyone that although we've removed the mask mandate in many settings, people still have the choice to wear masks, and we want people who choose to wear a mask to feel comfortable doing so. Of course, mask mandates remain in some settings on transportation and in healthcare. So now to tell you a bit more about our surveillance and our variants, I'd like to turn the podium over to Dr. St. George, who heads up virology here at Wadsworth. Dr. St. George, over to you.
Thank you, Dr. Bassett. Good morning. The scientists here at the Wadsworth Center Lab are constantly analyzing test results from across the state, and these are detailed sequencing data results. And since the end of January, more than 99.5% of the sequences identified have been of the Omicron variant in New York State. And the most recent data show, as Dr. Bassett just mentioned, that 42% of those Omicron sequences are the new BA.2 variant. This increase in the proportion of BA.2 is not surprising, but it has increased more slowly in New York and elsewhere in the US than in many other countries. And this information is available in more detail to all New Yorkers on our website at ny.gov/variant data. Wastewater surveillance is another important tool that we utilize in addition to human clinical samples to monitor the prevalence of COVID. This is a new program, and New York State now has monitoring in more than 50 counties, and this is being expanded to cover all counties and to include sequence analysis for variant distinguishing testing. It will also use high-speed sequencing methods to facilitate the rapid identification of variants and their circulation throughout the state. So we will have early warning signals at an even more widespread rate. And we are very grateful to the Governor for including a $5 million allocation in the executive budget to expand this very important and very powerful surveillance tool. Thank you very much, and I'll hand the podium back to the Governor. Thank you.
Thank you, Dr. St. George and Dr. Bassett. Again, just to put an exclamation point on something Dr. Bassett said, there are reports that there is a 30% increase in cases as results of the Omicron BA.2 subvariant. When you go from 8 cases per 100,000 to 11 cases per 100,000, that, yes, it is 30%. But it was just a few months ago we had over 400 cases per 100,000. So I just want people to understand the context of this as well. But we're being very diligent in making sure that we monitor the numbers in case the numbers do start increasing. Again, you heard from the doctor as well, the booster. This is what you're hearing in the news. This is what we're hearing from the CDC. The booster is the best protection against this variant, and we've had over 7 million boosters administered, but only 56% of the overall population has been boosted that are eligible, so we can do more. And my concern are people who are over 65. We've been very aggressive about making sure that not just vaccines, but boosters are available. They're required to be available at every single nursing home. We continue to make sure that our nursing homes make mask requirements, that there's testing available, so we know that's a vulnerable population. We're focused on it. So 73% of our nursing home residents are actually boosted. That's great, but that means there's still a number of people who are not, and we hope that their family members and their caregivers will make sure that that happens. So also not just seniors, but people who have underlying health conditions, people who are getting chemotherapy, cancer treatments, they're the ones that are vulnerable in the event that this variant starts to spread, and it does seem to be spreading faster than even Omicron based on what we're seeing in Europe. So we're not going to take our foot off the gas. We're protecting people with PPE tests, vaccines, and boosters, and making sure that the mask requirements in healthcare facilities remain in place. Also, we're watching the issue in Washington about a 4th dose. And I'm very anxious to get that approval, if that's determined by the CDC to be the next best defense against this variant. And as soon as it's signed off on, we'll be out there. That is why I'm not standing down our testing sites or our vaccination sites, even though we're having very few people come at this time. I want to see how we manage through this next, I don't know if it's going to be a wave. I don't anticipate a surge, but we have to be ready for anything. One thing we do know about COVID, Omicron, and Delta, wildly unpredictable. So that is why we're staying very vigilant about our approach to this. Test distribution, I mentioned we had 20 million more tests out to nursing homes, adult care centers, our NYCHA residents, senior centers, food banks, building on the 54 million. I mean, this is quite extraordinary. And I want to thank Jackie Bray and her team, the emergency operations, in addition to battling hurricanes early on and snowstorms, it seems like every single weekend. She's also been managing our state response in terms of getting our million tests out there, 54 million tests out there, as well as Catherine Garcia, our state operations. So they have been laser focused on these issues. We've had over 90 million tests out already, and we're going to stockpile. This is what I keep saying to the team, okay, amass them, collect them, get them in hand, make sure that we have more than enough so we never feel vulnerable. And we're going to make sure that we continue to keep New Yorkers safe as we move safely through this pandemic. So let's just talk about some of the numbers. So again, that is still the trend we want to see. January is a bad nightmare. We think about that. And those numbers kept going up and up and up. And we expect the numbers to fluctuate. Just be prepared for that. Again, we're not sounding any alarms here. People continue on with your lives. Be careful about those that we've identified as being most vulnerable. I hope you're taking good care of older parents and people who have compromised immune systems, but we're still way down, so far down from our peak of 90,000, which is something that New Yorkers should still be proud of. This is what they were able to do, help drive this down. We still watch the numbers in every region, largely the same trend, our cases per 100,000. Our overall positivity, 2%. 23% just back in January. So these numbers are really a positive sign of how far we've come thus far, but always being vigilant. Hospitalizations, again, this is always a lagging indicator behind new cases, infections, illness sets in, hospitalizations, and then deaths at the end. And we did lose 6 New Yorkers yesterday, and we have over 900 people still in hospitals. But the trends have been going way down, and so this is something that we think is a tremendous story. And again, our new admissions, we're still watching to see whether or not these are people who are just incidentally testing positive for COVID, which is something we started doing months ago before anybody else did. We realized that everyone who enters into a healthcare facility, they're tested, but they may be in there for wholly different causes. But so we want to make sure people know that that's a distinction there. So to give you a more accurate idea of what the real hospitalizations are all about, hospitalizations are continuing to be down as well. So great numbers there. Vaccination progress. We're still number 1 among large states for fully vaccinated total population. We're number 1 among large states for fully vaccinated 12 to 17-year-olds. Number 2 among large states for 5 to 11-year-olds fully vaccinated. I want to get that up a little bit higher. And also, again, parents, if you didn't hear us last time, we're going to say it again. Protect your children. Don't just get them vaccinated. Make sure that they have their full vaccinations. We want to make sure everybody's boosted who's eligible as well, too. So we'll be ready for this. This is the message to New Yorkers. We've learned a lot. We know how to handle this. We are not in an alarmist mode. We're not panicking over this. We're just watching the numbers and want to make sure everyone knows what we know at the same time. So the vaccines will continue to be critical tools. Stay vigilant. We're going to make sure that everyone gets vaccinated. I'm not shutting down sites. Just want you to know that. I'm not shutting down the testing sites. I've seen some other states have. Even if there's just a few people showing up there, we are going to stay on top of this. And so that's our overall message, because there's a lot of concern. I've had a lot of questions over the last couple weeks about what this variant is about. I brought you to the place where this is a nation-leading facility. They understand more than most how to address this, and I wanted to make sure we always take advantage of our experts here today. I will take questions. We are into budget negotiations, but I do want to say there's a lot of interest in them, I can tell, from all of you. And I know people feel very strongly about these issues, without a doubt. And I've made it clear for months that public safety is one of my top priorities. We've had many conversations behind the scenes about this. I've been taking action to reduce gun violence, try to address the trafficking of illegal guns. We have a task force that's set up. We've been working closely with them. I'm continuing to monitor their activities. I was down the subway. We're working on our teams to help people who are in subways find the mental health services that they perhaps need, or supportive housing, so we're committed to that. But I've committed to my partners in the legislature that I will not be negotiating the budget in public. So we have 10 more days to go. We're working on it, and that's what I want to say on that. So any questions? And if you have hopefully questions that the public is actually very interested in on what's happening and how safe they feel. Yes?
Governor, you say you're not negotiating the budget through the media, but a 10-point public safety plan attributed to you was leaked to the media. Can you confirm that you are pushing for these changes? And what do you say to criticism from legislators that are saying that somebody, somehow connected to your office, leaked this plan as a negotiating ploy?
That's not accurate. Number one,
What's not accurate?
It's not accurate that it was leaked from our office. We've been very clear about that. It is not, because we've been working on this for a long time. We've been trying to make progress behind the scenes, and it was presented as our position to the leadership. And so it doesn't matter how it got out, but I assure you that's not how I operate.
But if you don't negotiate in public, you introduced a budget in January.
Mm-hmm.
You introduced amendments. You said time and time again that, maybe I would consider bail reform if the legislators push for it, but I'll be working with them. Then this is thrown 2 weeks from the budget. Why is it good then to not negotiate policy in the budget? Because the public simply has no idea where you stand on this issue until you just confirm this plan was yours.
Because I know there's an end to the process. I know this is very interesting to the media, but I do know that New Yorkers are most interested in results. And I know how to get results, and it is by working smart, working with our partners, showing them respect. And I'm sure it's not the first time in the history of New York that an internal document landed in the press, but I actually know how to get something in the press. If I want to, I'll just hand it to somebody. we didn't do that because I wanted to have time to be able to have these conversations confidentially. That's how I operate, and everybody's just going to understand that over time.
There's an argument that New Yorkers are very concerned about the rising crime rate and want to know what's causing it. I know you don't want to negotiate in public, but why not make a public presentation if these are ideas that you back to, let everybody know about it and consider them in public?
It's also about building consensus. And maybe this is not how it's been done before, but as I've said since August 24th, it's a new day in New York. It's a new day of how I'm presenting the budget. The public is aware that I share their concerns about public safety, and that's why we're working with my team and working with the legislators to craft a position and a policy and work toward getting it in the budget that I believe will respond to the needs of what's going on right now. And that's the approach we're going to continue taking.
Governor, on these public safety issues, though, are you confident that you can reach an agreement with the legislature, just based on your conversations that you have had with them over this next week and a half, considering that, people on the Republican side of things have said that they want to have a complete and utter, retooling of this law, and some of the progressives and the advocates have said they do not want any changes whatsoever. It seems like a very difficult, narrow road to cross here.
Well, I have 10 days to work that out. I didn't sign up for this job because I thought it was easy. I've been lieutenant governor through a long process. I understand how this works. I've been governor. This is not the first time I've had the opportunity to negotiate and work with individuals. I know how to bring people together, and I'm going to continue meeting people where they are, listening to their concerns, and also knowing that I have also the safety of New Yorkers at stake, as well as protecting the rights of individuals who are accused of crimes. I will strike the right balance in what we're doing here, and I feel confident. So I actually have to work on a budget right now. So.
One question. Last month, your administration suspended enforcement of the booster mandate at hospitals and nursing homes and said your officials have taken a look at the issue in May to decide whether to take more steps to increase booster rates. But given the prospect of a new wave, do you think the state should now be looking at ways to increase booster rates at nursing homes in particular?
That's what we're looking at. We've mandated that booster shots are available at every single nursing home. I've had that in place, I think, since October and November. And we actually talked about touching base with all of our nursing homes again, see whether they're having more success, because I believe that that's important. But again, I think you'll also understand that this is going to allow us to have the flexibility I've asked for along and I've insisted upon, because we don't know what's going to happen. The numbers may stay where they are right now. They may not change. They may go up incrementally. It may be a less severe subvariant than we've seen before, where it's just a couple of days of minor flu symptoms and everybody's back. So we just want to have the ability to look at the circumstances as they're unfolding. And yes, we're watching this number, and we do want to get more people boosted, actually.
Is it time to spend $1 million for the Buffalo Bills Stadium at this point?
Pardon me?
Is it the right time right now to spend potentially $1 billion of taxpayer funding on a Buffalo Bills Stadium?
Where did you hear there's $1 billion for the Buffalo Bills?
That's what's been reported, but
Okay.
is that a...
I would say not negotiating in public. All will be told at the right time. Thank you, everybody.
More so on the background there that, as the governor said, this is widely unpredictable, but
Yes.
here you are saying that things will not rise to the same level as it is in the UK. What information can you give New Yorkers to make them feel confident in that statement?
Well, part of it is the way in which BA2 has entered the United States and our state. So it's been creeping up, but it hasn't been the cliff that all of us recognized with Omicron. I don't know if I should call it a cliff, but we all know the familiar Omicron spike. And in other countries, they have seen what looks like a familiar spike related to the BA2 variant. We haven't seen that in this state, and we are monitoring it. And this state is not unusual, as I understand it, from Dr. St. George, who's welcome to speak to this as well. This is a pattern that we've seen in the United States generally. I can't tell you exactly what might account for that. As you know, the patterns of transmission are related to people's vaccination coverage, to their behavior, and to the virus itself. But that's the pattern that we've seen so far. And so far, we have seen these upticks, but we haven't seen this vertical type rise. I also want to make clear that we're being vigilant and that this may change, and we will be watching. So I don't want to promise you that it won't change. I can't do that, obviously. Dr. St. George, do you want to add anything to that? Or? Okay.
Where you would recommend imposing or putting some guidelines back in place for, say, mask wearing or social distancing, things like that, if there is another spike here?
So the first thing that I want to talk about is the fact that we still have a lot of people who are eligible for boosting, including people over the age of 65 who have accounted for the largest share of COVID deaths, who haven't gotten boosted yet. I really want to get our numbers up. I want people who have not been boosted and are eligible, please. This is a good time to get boosted, and the same thing for our kids who are eligible for boosting if they're 12 to 17. The other part that we've emphasized as a lever that has not really been fully utilized is the access to treatment. And I think many people, providers and patients, aren't aware that we have effective therapeutics now that will take somebody who has mild or moderate symptoms, and if treatment is initiated early, the oral agents have to be initiated within 5 days of symptoms, the sooner the better, then we get a reduction in hospitalizations from that. But of course, we know all about the masks and the distancing and the other tools that we continue to have in our toolbox, and we continue to have the legal frameworks that are needed.
How are at-home tests?
I'm here, I was just left here by the governor. How long should I keep going? Okay. I'm not trying to be inaccessible. We do want to answer your questions. It's very important that you get information to the public. Thank you. Carry on.
So on at-home tests, how are those being taken into account in the numbers? Is there a concern that the numbers might be even higher than what's being presented?
You're absolutely right that we no longer are capturing all the people who test positive. You heard that the governor say that we've had over 50 million home test kits distributed, and we know people are procuring them on their own through the federal government. There's a lot more home testing going on, and we are not capturing those results. But when the laboratory confirmed tests begin to go up, we pay attention to it. Although it may be incomplete, it likely is incomplete. That's why we shifted to a focus on hospitalizations as things were going up. As we come down, what we're paying attention to is the directionality, the slope. Okay. Last question.
How concerned are you with hospital staffing levels, since that's really the focus?
Well, of course, we're very concerned about hospital staffing levels. This was a challenge. Many of the concerns we had about hospital capacity during the Omicron surge were related not only to the demand for hospital beds, but to our ability to staff them. But at this time, we are in a very good place with respect to hospital capacity. That is not a present concern, but we still are concerned about replenishing our health care workforce. There are lots of reasons that it's diminished, and it's very important that we replenish it. Thanks very much.
Thanks, guys.
I like answering questions.
You're great at it.